Joining us here at ONS 2010 is Mikaela Olsen, Oncology and Hematology Clinical Nurse Specialist from the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins. Thanks for being with us.
Thank you for having me.
So, comorbidities in cancer patients. When somebody has cancer and they have diabetes, that only adds to the complications. What are some of the greatest challenges oncology nurses face today in caring for these kinds of patients?
Well, cancer is a complex specialty, and so is diabetes. And almost 1 in every 3 of our cancer patients will have diabetes with their cancer. And we can't ignore the problem of diabetes because it is so prevalent in our patients, and it makes them have potentially higher rates of infection, potentially respond less well to their chemotherapy, and so we need to address the problem. So the challenge is having oncology nurses that are knowledgeable in cancer, but also can become more knowledgeable in the current state of diabetes. It's very complex. We are going to have to attend seminars, learn the resources that are available to us so that we can care for these patients with cancer and diabetes.
What are the major risk factors in disruption of glucose control in a patient who has both cancer and diabetes?
Well, when they come in for their cancer treatment and they already have diabetes, the first question to ask is it controlled or poorly controlled? And so we usually try to get an A1C on patients to see what their baseline glucose control has been. Then we do things to them that increase the hyperglycemia. For instance, we give them drugs like potentially a regimen that includes chemotherapy such as asparaginase, which causes transient hyperglycemia. Add in steroids in a patient can increase hyperglycemia. Tacrolimus is another drug that can cause hyperglycememia. Other things that increase hyperglycemia in anyone that has diabetes: stress, infection, and we know all of our patients are going through those things as well.
How can oncology nurses prepare their patients for management through their cancer and diabetes when they have periods of nausea, vomiting, and even anorexia?
Well, nurses need to have the tools to be able to manage patients with diabetes. I think that the glucose checks in a diabetic patient are a vital sign for a diabetic patient. And it's of the utmost importance that nurses are trained in how to check patients' sugars, that patients have glucometers in their homes, that they can check their sugars and monitor them, because they may be on a regimen that's working for them at home. Now they have cancer, they're trying to get their treatment, they have nausea, vomiting, they don't have an appetite, so their nutritional needs need to be balanced with what you're giving them to control their sugar. And that balance changes when you're going through cancer therapy. When the balance changes, then you have the potential for too much insulin on board, too much of the medication to decrease the sugar, and now you have hypoglycemia, which can be very dangerous. So it's a careful balance.
And you're also basically dealing with helping them to manage increased levels of stress when all these things happen.
Exactly. Stress and the potential for infection.
What resources do you recommend for oncology nurses who have patients who also have diabetes?
I would recommend nurses attend a diabetes management course that has the up-to-date information on the current state of diabetes. We've changed our practices greatly in the management of diabetes. We no longer recommend regular insulin for patients. We have new rapid-acting insulins that nurses need to be aware of. We use an approach called basal, nutritional, and correctional to correct patients' sugar, which is more naturally like the way our pancreas works. I would also recommend the many internet sites that can be utilized for nurses to increase their knowledge, one being www.ace.com, which is a great website which has a lot of tools, education, and resources for nurses.
Mikaela, thanks for spending a few minutes and sharing some really good information.
Thank you.
Mikaela Olsen from the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins, here at ONS 2010.